Joining us is Dr. Céline Gounder, a member of President-elect Joe Biden's COVID-19 advisory board. She's an epidemiologist and infectious disease expert at the NYU Grossman School of Medicine and Bellevue Hospital Center here in New York. Dr. Gounder, good morning. Thanks for being with us. As we just saw, California is again going into regional lockdowns. How effective a strategy do you think that is?
So, I think we are unfortunately having to look at restricting certain activities, dialing up some of these restrictions around dining, around other group activities. We know that when you are indoors, when you are crowded amongst other people, and when you're not wearing masks, that increases the risk of transmission. So unfortunately, given how out of control the virus is at this point, we are having to dial up some of those restrictions again.
Dr. Gounder, we should just tell viewers your shot is frozen, which is why we're not looking at you, but we can still hear you. You think other states should take this kind of measure if they're in similar situations?
Well, I think ideally we should be more proactive than this, where we don't find ourselves in a situation where the virus is to this degree out of control. Unfortunately, not everybody decided to stay home in their household bubbles, to wear masks, to socially distance, to have activities outdoors versus indoors over the Thanksgiving holiday. And we're now seeing the resulting surge from that.
The chief scientific advisor for Operation Warp Speed, Dr. Slaoui, says he plans to meet with the Biden team this week to discuss a distribution of a vaccine. What do you need from Dr. Slaoui to ensure a smooth transition?
Well, we really need to understand what their plan for distribution is. We've already been trying to get a handle on how many doses will be available to us from each of the companies and by when, but we do need some internal information on that from the federal government. We also need to understand where they are with their plans. It's not enough to acquire the doses of the vaccine, to purchase the doses. You also need to have a plan to distribute them all the way down to the level of the healthcare provider, the nurse, who's going to inject that dose of vaccine into somebody's arm. And so we really need that level of granular detail on where they are with the vaccine distribution planning.
And you haven't gotten any of that yet?
We have yet to see any kind of detailed plan.
What is your biggest concern regarding the distribution of the vaccine?
Well, I think a couple. One, we want to be sure that there will be enough doses, as have been promised. We know that we're not going to be able to vaccinate everyone all at once, but we need to have some realistic projections so that we can prioritize the doses that we have accordingly. And we really want to make sure we're vaccinating for maximum impact. We want to be preventing deaths, and we want to be preventing transmission. And you can't really make a plan for that if you don't know what tools you're working with.
Quickly, Dr. Gounder, we heard Dr. Burke say this is the worst event the country will face. What do you expect in the next few weeks here before Christmas?
Well, sadly, hospitals are overrun. I think that is going to get worse, frankly, over the next couple weeks. I am still seeing patients. I know my colleagues are really burned out from being on the front lines fighting this for months, and now they're being asked to see that many more patients. They themselves may not be able to take time off over the holidays, and that's going to contribute to burnout as well. And I think, unfortunately, some Americans may continue not to follow the public health guidance that we had offered before Thanksgiving, and that may lead to further transmission over the upcoming holidays.
Dr. Céline Gounder, thank you very much for joining us this morning. We appreciate it.